on influenza and its prevention from, let's share this slide, from Hetero Healthcare. Hetero Healthcare, as you all know, has got 30 years of excellence with 36 state-of-art manufacturing facilities, 300 plus products in portfolio, presence in 126 plus countries. We have 21,000 employees globally and amongst the largest manufacturers of ARV, APIs, and FDFs in the world. Hetero Healthcare is 360-degree solution provider striving to fulfill unmet healthcare needs, reaching to customers across India with wide range of products encompassing multiple specialties, pioneering in quality and innovation. Hetero Healthcare has distinction of bringing 4 biosimilar products to market within 5 years of initiation: darbepoetin alpha, rituximab, bevacizumab, and adalimumab, for which even during the COVID era, Hetero Healthcare, the pioneers in antivirals, offered fluvier, oseltamivir, favipiravir, and remdesivir, for which Hetero received an award of Pharma Excellence in August 2020 for COVID drugs. And in today's meeting on prevention of influenza, we have got eminent speakers, Dr. Sampat Kedare and Dr. Keyur Mahajan. Welcome, doctors, to this meeting. Just to mention a brief, Dr. Sampat Kedare is MBBS DCH Boston, ex-medical superintendent government of Maharashtra, ex-member secretary state rotaviral committee, and service consultant pediatrician Kedare Hospital, Bal Rugnalaya, Chakhand. Dr. Keyur is MBBS JNB Pediatrics Pune, Diploma in Pediatric Infectious Disease Oxford UK, and Pediatric Infectious Disease Consultant Pune. Welcome, Dr. Keyur and Dr. Sampat, and over to you for further deliberation. I'll stop my sharing. You can take over.
Very good afternoon, all. Hello, am I audible to you all?
Yes, sir. Yes, sir, you are.
Very good afternoon to all. Friends, today here we have come together to discuss about something about influenza and its management. Friends, as you know, influenza is a very important viral disease in the current scenario, because we are facing number of cases out of 100 OPDs. Nearly we are facing 20 to 25 cases per day. So it is obligatory on part of us to know something and to get sensitized something about influenza and its repercussions and its complications. Friends, influenza, as you know, it is one of the very seasonal illness which we are regularly facing every day in day-to-day practice. So while going through the epidemiology, influenza is a common scenario which we are facing in day-to-day OPD, and we cannot neglect each and every patient who come with high-grade fever, headache, body ache, malaise, anorexia, nausea, vomiting, and in case of infants, there may be loose motions or vomiting. So in this case, what we have to do is that we have to know the various types of influenza viruses. As you know, we know that there are types of viruses: influenza A virus, influenza B virus, and influenza C virus. So what are the healthcare challenges in monsoon and their diagnosis? So we face influenza-like illnesses. Which are the influenza-like illnesses? We face adenovirus, influenza, rhinovirus, parainfluenza virus, and metapneumovirus.
Okay, there is, excuse me.
Yes.
But we are unable to see your slides on the screen.
Okay. Not at all. Can you see?
Not at all. Yeah, we can't see your slides.
Can you? Yeah. So no. So while seeing many patients like viral illnesses, we have to think influenza virus as a top priority. So what is the dynamics of occurrence?
Share your screen, sir. We can't see slides. You can stop sharing and start sharing.
Just a minute, please.
So we are able to see and hear you only, but not the slides.
Can you see, please? Can you see slides?
No, sir.
Not a single.
सर हे व्हॉट्सअपचं दिसतंय तुमचं, तर त्याच्यात माझ्या लिंक मधून तुम्हाला स्लाइड्स मिळतील.
आता दिसते का मॅडम?
नाही सर. हे तुम्ही स्टॉप शेअरिंग करा आणि परत रिशेअर करा. हा, नाव वी कॅन सी यू.
आता
वी कॅन सी यू बट नॉट युअर स्लाइड्स.
not the slides.
अरे बापरे. Can I see now?
नो सर.
Okay, just a minute.
काय म्हणतायत ते?
Stop sharing, stop करा म्हणून.
केलंय.
Stop.
share. स्टॉप
Please,
केलेला आहे.
येस.
आता दिसतात. आता
आणि
दिसतात.
जरा झूम
दिसतंय
करा.
का
guys.
आता?
झूम करा.
Zoom करून देऊ.
आता दिसतंय का?
Can we see please? Can we see?
सर दिसतात पण
can it
कट
be-
होतात.
दिसतंय का? फक्त विचारा, बाकीचं करते.
Yes. So, what is the dynamics of the seasonal variation in case of influenza virus? So, in various areas, the influenza virus present in different situations. In our area, usually it presents in monsoon period. So, what we have to think that we should be aware and we should be cautious and we should be mentally prepared to face the cases of influenza during this season. So, influenza possibly started with the onset of monsoon and peaks during the post-monsoon seasons. So, this is a study that we have conducted during the period 2015 to 19, where we have come across that you can see number of cases that they increasing per year to the tune of nearly 3 lakhs. And we have to take it to the cognizance of it that number of deaths due to influenza are also increasing to a greater extent. So it becomes obligatory on part of us to be vigilant and be alert in the management of influenza-like illnesses. So what is influenza or flu? Influenza is one of the most common infectious diseases caused by influenza virus. It is highly contagious virus, airborne disease, which occurs in seasonal epidemics and manifests as acute febrile illness. So in each and every case of acute febrile illness, we should suspect that it may be one of the influenza may be one of the cause. So it can cause mild to severe illness. Now, the serious outcome of flu infection can result in hospitalization or in death also in some cases. As you can see the slide, this is how you can see the influenza virus. So what are the types of influenza viruses? As we know, influenza A virus causes most frequent epidemics due to minor antigen variations and periodic pandemics due to major antigen variations. This is what makes us that we should be alert, and these minor antigen variations makes us to get our vaccination, modified vaccination at each and every year. Number 2, that is influenza B virus that only infect only human and cause local epidemics. Number 3, influenza C virus, which infects human and swine. Influenza C virus infections are generally cause mild respiratory illness and are not thought to be cause of epidemics. And number 4, influenza D virus is also there, but is not seen in human beings, it is seen in animals. Currently circulating in human are subtypes H1A, H1N1 and B, H3N2 influenza virus. How does the influenza virus get transmitted? Friends, as you know, the people who with flu can spread it through others up to the distance of 6 feet away. Flu viruses are spread mainly by droplets made when people with flu cough or sneeze or talk. Number 3, these droplets can land on the mouth or nose of the people who are nearer or the possibility to be inhaled into the lungs. Number 4, people who stay away from the affected person can stay at home if sick. It is also important to wash hands often with soap and water. Most healthy adults may be able to infect other people beginning 1 day before, 1 to 2 days because the symptoms are developed up to the 5 to 7 days after the becoming the sick. Specifically, the adult, it is commoner for adults. And number 4, the children may pass the virus for longer than 7 to 14 days also. It has been recommended in books that says that it can last and virus may pass up to 7 to 10 or 14 days. The transmission of flu virus. Tai? So apart from that, don't get How does the symptomatic differentiation of various types of virus? Influenza like illnesses, H1 infection, severe acute respiratory infections, and COVID-19 infections. As you can see the chart, there are various symptoms: fever, myalgia, cough, lethargy, lack of energy, sore throat, breathlessness. So these are all the things which are common in all types of viral illnesses. Number 4, breathlessness may be or may not be present in influenza-like illnesses, but in H1N1 and SARI, a severe acute respiratory infection, and COVID is common. Loss of smell or loss of taste is commoner in COVID, and there is no change in loss of taste or smell in case of influenza-like illness, H1N1 or SARI. Diarrhea is common in COVID, but not common in other things. But we can see in case of influenza illness, in infants specifically, the patient choose can present with diarrhea and sometimes in vomiting also. In that case, we can suspect adenovirus infection also. The headache is also there, which may or may not be there in case of influenza-like illness. It may be present in H1N1 or may not be in SARI or sometimes in case of COVID-19. So what are the emergency warning signs of flu sickness? As you have come across, there are various how the kids or how the adults present with various illness, various symptoms. But in case of emergency warning signs, which are the warning signs for which we should be mentally prepared? In case of children, the fast breathing or trouble breathing, there is cyanosis, or child is not drinking enough food, not waking, or not interacting with each other, being so irritable or lethargic that may cause child does not want to be held. Flu-like illnesses may improve but return to fever and worse. Flu-like symptoms improve but then return with fever and worsen the cough. This is very important. In case of kids, usually some patients, some bachus may present with cough which will last for a prolonged period. And lastly, fever with rash is also one of the very warning signs. In case of adults, what are the warning signs? The difficulty in breathing or shortness of breath. Number 2, pain or pressure in the chest or abdomen. Number 3, sudden dizziness. Number 4, confusion, severe or suppression vomiting, and flu-like illness that may improve or then return to normal. I would like to highlight the things. The kids, in case of kids, those kids who are at risk, they should be taken care. For example, children which are less than 2 years, children having comorbid conditions in the form of cardiac illness, in the form of some cardiac intervention had already been done before in the form of some surgery. Number 3, recurrent respiratory tract infections, recurrent chronic renal diseases, failure to thrive kids, kids of immunodeficiency diseases, or these are all the children which are at risk, where the illnesses they are worsened very fast as compared to the kids which don't have symptoms. These are the very important warning signs for which we should be alert and we should be very prepared for it. In addition to these signs, above mentioned signs, get help right away for any infant who has any of these signs. For example, unable to eat. Number 2, has trouble breathing or has no tear even crying, or child is drowsy, or child is lethargic, or significantly fewer wet diapers than normal. That means mild diarrhea progressive diarrhea is there. So these are the warning signs for which we should be vigilant, we should be observant, and we should regularly follow the kids. So which are the complications which are of the flu which we come across? The complications are slightly commoner, which are as I have discussed, in immunocompromised hosts. For example, kid less than 2 years, children with some comorbid conditions, children with previous illnesses, children with recurrent illnesses. These are the cases where complications are slightly higher. Complications which we come across routinely are otitis media, pneumonia, bronchitis, bronchiolitis, secondary bacterial infections, worsening of the existing disease like asthma or COPD, acute respiratory distress syndrome, or sometimes we may face death, which is because of invention of drugs like oseltamivir. We are coming with lessening the number of deaths due to influenza lysis. So how to manage such cases? Friends, as you know, the treatment of all viral infections is only symptomatic and supportive. But we have to be vigilant and alert as we had discussed just before for warning signs. The treatment is largely supportive and consists of bed rest, increased fluid consumption, cough suppressant, antipyretics, analgesics such as paracetamol in appropriate doses, NSAID for fever and myalgia, and treatment of dehydration with addition of fluid consumption properly. And I will like to add more things that we should be observant and we should be very much careful for the high-risk kids, high-risk class of patients for where the chances of complications are somehow slightly higher. So most patients with influenza recover in 3 days. However, malaise may persist for 4 weeks together. Severe cases may require intravenous hydration or sometimes supportive measures. Here, we are supposed to be vigilant for the treatment which are the kids which require specific treatment, appropriate treatment, and prompt treatment properly. So, suppose you come across all viral illnesses, we should be vigilant for signs of some complications, which so that we should be worried about it and we should see that the child doesn't land into complications. So, what we are discussing prior, that what will land in complications, along with those complications mentioned, we do come across the complications, neurological complications. In case sometimes we may come across meningitis, encephalitis, encephalomyelitis, GPS, Guillain-Barré syndrome. These are the complications which we come across. We should be prepared for these also. Again, there are some renal complications, some cardiac complications also are seen. Myocarditis also seen in some cases. So what is the treatment we should do? Along with the regular symptomatic and supportive treatment and observation for the high-risk complications, we should also start the treatment with the antiviral drugs, which are the antiviral drugs which are specifically used and specifically prepared. Friends, as you know, H1N1 influenza infection has got 2 viruses, influenza A and B, and which A is specifically commoner for humans, and the antiviral which block the viral neuraminidase enzyme, which is critical in the releasing of virions from the infected host cells. These drugs are active against influenza A and B. So which are the drugs? These are the oseltamivir and zanamivir. So amantadine is not to be used because it has been showed that it has got a lot of resistance, so it should not be used. We should not think of using this thing. So what is how to give oseltamivir? Friends, as you know, so which are the candidates which need oseltamivir? The kids which are simple, uncomplicated, healthy kids suffering from influenza-like illness, we may not give direct antivirals, but they should be monitored for properly, and they should be monitored for some complications. And if we feel that these are at-risk clients, we should not delay the starting of initiation of antivirals in the form of oseltamivir in appropriate doses. Oseltamivir is a potent selective inhibitor of neuraminidase enzyme of the influenza virus A and B. It is a drug. It is a prodrug which is converted to the active form of oseltamivir carboxylase in the liver. It inhibits the influenza virus replication and pathogenicity. It prevents further spread of infection, and it is effective against all strains of influenza A and B, including the avian H5N1, swine flu, or H1N1 or H9N2 strains. This is the schematic diagramic representation how oseltamivir acts as it gives the neuraminidase activity. We will not go in detail, but as we said, the lower sides, you can say that it helps as a inhibitor, neuraminidase inhibitor. So it prevents the halts of viral replication. So thereby it prevents the further spread up and complication of disease. So it is the first oral drug which is neuraminidase inhibitor, which is approved in more than 100 countries, and which has been found that it is more better than anything, which helps to prevent further complications, if you start it earlier. So friends, when it started, it should be started initially it should be initiated within 48 hours of the onset of the symptoms. That is most important. Specifically, those are high risk candidates who are having already some comorbid situations. These are the candidates where we should not wait for the patients to develop full-blown signs. Because if you are late in starting initiation of oseltamivir, we will not get expected results. Because if the earlier we start, the earlier is the effect, and the earlier the it helps in reduction morbidity, mortality, and prompt recovery. So, what are the doses? These are the doses and recommendation. As we say, in case of adults, the dose is 75 milligram capsule twice a day for 5 days, and chemoprophylaxis we can give only once a day. In children weighing less than 15 kg, we have to give 60 milligram per day in 2 divided doses, and in the same chemoprophylaxis 30 milligram OD for 10 days. Weight 15 to 23 kg, we have to give 90 milligram per day in 2 divided that doses, that is 45 milligram once a day dose. Number 3, children weighing more than 23 to 40 kg, we have to give 60 milligram BID, and prophylactically we have to give 60 OD. In children or patients more than 40 kg, we have to give 75 milligram BID, or in case of chemoprophylaxis, we have to give 75 milligram OD. Infants less than 2 weeks or to less than 1 year, we have to give 3 milligram per kg twice a day for at least 5 days. Friends, I would like to add on these things. When we are sure and when our diagnosis is clear, so we can give the dose not only for 5 days. In case of comorbid situations, we can give the dose. We should give the dose for 10 days also. And in case of it is as we the recommended duration for post-exposure prophylaxis is 10 days, and the recommended duration for treatment of outbreak disease prophylaxis up to 6 weeks also is recommended. So this is very important for us. So what are the benefits of empiric use and early use of oseltamivir? As you know, friends, the influenza, initially it becomes very difficult for us to diagnose each and every case of viral illnesses by doing RT-PCR or some other investigations. So it takes time, and also sometimes there may be false negative cases as against false positive also. So instead of waiting for the results to come, or even though the patient is false negative, we should not delay the starting of treatment. So this is a wonderful drug for walking pneumonia. This is oseltamivir. This is the adult side that will not go ahead. Oseltamivir treatment for influenza illnesses reduces low respiratory tract infections, reduces the antibiotic uses, and hospitalization. This was a study which was done in nearly 3,500 cases with influenza-like illnesses, which enrolled 10 placebo control studies. Double-blind control study has been done. The patient with influenza oseltamivir treatment reduces the further progression of the disease, reducing occurrence of severity of pneumonia due to H1N1 by early oseltamivir administration. This is a study conducted in 442 patients, which were where medium onset of symptoms was there for 5 days. The subjects were divided into 4 groups based on the oseltamivir administration in less than 2 years, 3 to 7, 8 to 14, and more than 14 days, where it was showed that both the probabilities of the severity of pneumonia and probability of the severity of pneumonia increase gradually with the time from the symptom of onset to oseltamivir administration. Earlier initiation of oseltamivir administration after the symptom of onset significantly reduced the occurrence of severity of pneumonia and shortened the hospitalization due to pandemic H1N1 2009. When administered 48 hours after the onset of symptoms, oseltamivir showed considerable potential for reducing the pneumonia and also reducing the other complications, otitis media, or other complications. So friends, patients with a shorter time to oseltamivir admission were discharged earlier than from the hospital as compared to the patients which were not given oseltamivir or which were administered late oseltamivir. This oseltamivir azithromycin combination, we are not these things. The collaborative study doesn't go hand in hand, so we leave it. So what are the guideline recommendations? What are the WHO recommendations for use of oseltamivir? It is strongly recommended by WHO. Number 2, treatment should be started as soon as possible. Number 3, confirmation of influenza virus is not necessary for the initiation of treatment. This is very important. You can underline this. Laboratory confirmation of influenza virus is not necessary for initiation of treatment. As our Nelson textbook also says the same thing. Negative laboratory test for HIV does not exclude the diagnosis and the patient, and therefore early initiation of oseltamivir is always helpful. If higher risk of individuals have been exposed to the patients with influenza, consider presumptive treatment with oseltamivir. Here, I would like to add one more thing. If we are treating one case of one family member of the patient with oseltamivir, we must search for family members, other family members. We should always be given a chemopapillary for the influenza. The early and empiric supportive treatment and monitoring. Give empirical antimicrobials to treat all likely pathogens causing SARI. Actually, if we are sure that diagnosis of it is influenza, which is confirmed by some laboratory investigations or RT-PCR, so if we are sure that the patient is not developing secondary bacterial infections, we should withhold antimicrobials as far as possible. But those patients which we come across some complications or underlying pre-existing illnesses, we should stop using antimicrobial strongly and appropriately as per the situations. Empirical antibiotics should be based on the clinical diagnosis, that is communicable acquired pneumonia, healthcare associated pneumonia, and infections associated acquired pneumonia and healthcare setting are sepsis. That's very important. The empirical therapy includes neuroamylase inhibitors for the treatment of influenza, where there is local circulation or other risk factors, including travel history or exposure to the animal or influenza viruses or exposure to the other patients who are differently suffering from influenza. The adult with communicable acquired pneumonia who test positive for influenza, should the treatment regime include antiviral therapy? So what are the recommendations by WHO? WHO said that we recommend that anti-influenza treatment such as oseltamivir or baloxavir prescribed for adults with CAP who test positive for influenza. In these such settings, independent duration of illnesses before the onset, before diagnosis, strong recommendation is promoted. Several observation studies suggest that treatment with oseltamivir is associated with reduced risk of death in patients hospitalized for community acquired pneumonia who test positive for influenza virus. So treatment within 2 days of symptoms of onset of or hospitalization may result in the best outcome, which prevents morbidity and mortality. So although there may be benefits up to 4 to 5 days after the symptoms begin. So friends, in summary, what we have come across is that proper diagnosis and early treatment can prevent the flu complications. Proper diagnosis means what? Your strong index of suspicion, number 1. Your clinical epidemiological vigilance, number 2. Number 3, past history of 3 to 4 years of occurrence of same illnesses in the same period. So that makes us that we should be worried that this could be the season, flu-like season. So this is a strong suspicion. Number 1. Number 2, with age of the patient, if the age of the child is 2 years, less than 2 years, if the kids having comorbid situations in the form of cardiac illnesses, in the form of renal, in the form of hepatic, or in the form of other illnesses, where the long-term treatment is going on, in those kids which are already suffering from AIDS, for example, or another immunodeficient diseases, which are where we suspect that this could be lead to complications. So we should not wait for the child to start with empiric use of oseltamivir. Empiric use of oseltamivir reduces low respiratory infections complications, hospitalization, and its use also. So along with this, the empirical use, it helps to in reducing the CNS morbidity and CNS mortality also in the form of encephalitis, cerebralitis, Guillain-Barré syndromes, or other acute febrile causing convulsions or meningitis. Number two, last, WHO or American Societies, Thoracic Society says that it recommends empirical use of oseltamivir in a proper way. So, thank you with this. Along with this, I would like to add that what about the vaccination? Hello, may I hear you, please? Hello.
Yes, sir, we can hear you.
I would like to add something about the vaccination. As we have come across, there is a good, and this is the peculiarity of the influenza vaccine virus is that there is change in the mutation, and there is classical change antigen drift. Each and every makes us to be alert that the virus is going to change itself during each and every year. So it becomes obligatory on part of us to be prepared to vaccinate our child, not only up to this age of 6 years, from infancy to 6 years, but it has been recommended that we can continue the vaccination up to the age of 18 years every yearly if there is no any contraindication. Number two, vaccination gives nearly 50 to 60% coverage, and which is really helpful, which helps to reduce the further episodes of influenza-like illnesses, and that helps to reduce the specifically in comorbid situations. So vaccination becomes a crux. Number four, I would like to specifically highlight use of oseltamivir really helps to curtail the progress of disease. It halts the progression of the complications. It halts the recovery. It promotes the recovery and helps the reduce the hospitalization and also the monetary burden over the beneficiaries. So with this, I think this we have come across the epidemiology, the presentation features, the clinical features in case of infant, adults, and what are the signs and symptoms of what are the complications, what are the treatment, and what are the chemoprophylaxis, in what doses we have to treat the cases. So with this, I think we will definitely be prepared to face and to manage all cases of viral illnesses, including influenza viruses, and better not to delay if at all we are sure that we are facing the clear-cut case of viral illness. Better not to delay the initiation of antivirals. But at the WHO have recommended that we have made categories that A, B, C, mild illness, moderate illness, and severe illness. But the thing is that we don't know which are the kids which are going to from A grade to C grade or B grade. So we should always be vigilant and monitor the kids properly, specifically for the any untoward mishaps, so that we should not delay in initiation of the antivirals. With this, I will stop my screen sharing, and I thank you and sorry for my slightly late presentation, initiation of presentation. I hope you will excuse me for my delay, and thank you again. And I will like to hand over my further session to my learned colleague, Dr. Keyur Mahajan, please. Thank you. Thank you.
Thank you, sir. My screen is visible?
Yes.
Yes, sir. Visible.
Yes, sir.
Okay. So, because we are learning late, I will have to be short today because I have got appointments next. So, as we have discussed, there are 4 types of influenza viruses, A, B, C, D. So, we will skip this part. Currently, we are facing subtypes H1N1 and other B types of viruses. So, I will skip this part of. So now, when a patient comes in our OPD with complaint of fever, cough, cold, throat pain, and we should differentiate whether this child is having bacterial or viral pharyngitis. And if we can differentiate that, then only we can prescribe proper antimicrobial, whether to prescribe antibiotic or whether to prescribe antiviral. So it depends on the epidemiology also, in which season you are working, in which area you are working, what kind of patients are coming to your OPD. So, but if you go clinically, you can see here is an image which will help us to differentiate between viral and bacterial pharyngitis. In bacterial pharyngitis, we can see there will be red swollen tonsils with whitish exudates over it. Throat will be red. There will be some gray furry tongue and swollen uvula. And in viral, of course, we will not see exudates. The tonsils will be red, swollen, but no exudates will be seen. And the throat will also be redness. So it is not just exactly differentiation, but it will help us to clinically differentiate between bacterial and viral. So this kind of picture we can see. The most common bacterial pharyngitis what we face is streptococcal pharyngitis, which will need treatment with amoxicillin in proper doses for minimum 10 days duration. And in viral pharyngitis, as you can see, the mucosa will be congested, but streptococcal pharyngitis, you can see enlarged tonsils with whitish exudates. So that I think will help us to differentiate between the viral and bacterial pharyngitis. Now, what are the current guidelines for management of flu? These are guidelines from both government and private bodies, which help us to guide how we should treat. All individuals seeking consultation for flu-like symptoms should be screened and organized or categorized into A, B, C in order to prevent and contain outbreak of influenza. So what is category A? Category A, patients with mild fever plus cough, sore throat with or without body ache, headache, diarrhea, vomiting will be categorized at category A. So as we have seen that influenza-like illness presents with GI symptoms also in pediatric population. So when we have cough, cold, fever along with some GI involvement also, we have to think about influenza-like illness. That these mild patients do not require oseltamivir, should be treated for the symptoms with the bed rest, plenty of fluids, paracetamol for fever. But as we have discussed, they can go from category A into category B or category C also. So they should be monitored for the progress and reassessed at 24 to 48 hours. Because if they are progressing, we need to start oseltamivir soon. But as we discussed, if we start oseltamivir within 48 to 72 hours, then it is very useful. So when on day one you see patient with mild symptoms, influenza-like illness, do ask them to follow up next day. So see whether the fever is becoming high grade or the child is progressing, then we can start oseltamivir. No testing for the patients of H1N1 is required of category A. Most of the time, the disease is not severe enough to warrant antiviral. This is self-limiting. Patients should confine themselves at home, avoid mixing of public high-risk family members. No laboratory testing requires such patients. In category B, in addition to all the signs and symptoms mentioned in category A, the patient is having high-grade fever, severe sore throat, and then we can think of starting of oseltamivir in these patients. Okay, also children who are high risk, like having predisposing factors, pregnant women, over 65 years of age, having lung disease, heart disease, liver disease, kidney disease, blood disorders, neurological disorders, immunosuppression, immunodeficiencies, long-term steroid therapy. In such patients, even though they are on category A, we can think of starting oseltamivir because they are in high risk predisposing conditions. Then, if possible, we should send a rapid influenza diagnostic test like RT-PCR. In these cases, nowadays after COVID-19, almost all labs are equipped with processing such kind of samples, and turnaround time has reduced to 24 hours. So we get result very next day. So, but don't wait for test reports to come, and don't wait if the patient is not affording or not willing to send the test. If you're feeling the child is falling into category B with severe symptoms, then you should start oseltamivir, preferably within 48 to 72 hours. Then category C, in addition to the above signs and symptoms, category A and B, if the patient has one or more of the following, like breathlessness, chest pain, drowsiness, falling blood pressure, sputum mixed with blood, release discoloration, that is hypoxia, and CNS signs like red flag signs like somnolence, hypersystem fever, inability to feed well, convulsion, shortness of breath, difficulty breathing, worsening of underlying chronic conditions, then these all patients should come in category C, and they should be they should be admitted immediately and started with the oseltamivir and other supportive management immediately. The investigation should be sent, but the treatment should not be delayed. It should be started as early as possible. In outdoor settings, we can start oseltamivir in 48 to 72 hours. It will be helpful. In indoor settings, there are studies which have done that. They have shown that even though in IPD patients in lower respiratory tract infections, we can start oseltamivir up to 4 to 5 days of onset of symptoms. So they are useful. So to summary of treatment guidelines, category A, home isolation, bed rest, plenty of fluids, paracetamol for fever, and monitor if they are progressing. Category B, above plus antivirals, preferably within 48 hours, testing may be done. Category C, testing should be sent, hospitalized, patient should be hospitalized, antiviral should be started with other supported treatment. So this is to summarize. So I will describe in short all other anti-influenza drugs. As we have know, these are the three categories of anti-influenza drugs. The adamantines are not used because there is resistance for adamantines, so there is no need to discuss them. Then cap dependent endonuclease inhibitors, oral baloxavir is available but not in India approved, so let's not discuss that also. Peramavir is IV neuraminidase inhibitor approved by FDA for treatment of acute and complicated influenza within 2 days of onset of symptoms in people 6 months and older. Again, the data in India is limited, but still it is available. But the more easily available option is there, and also it is the data for chemoprophylaxis in peramavir also not available, so we don't use it much. Then zenamavir is also available, approved for treatment of flu in children 7 years or older. Again, it is not recommended in children with underlying respiratory diseases, including those with asthma and chronic lung diseases. So it is available in inhaled form, given by a special inhaler called as descaler. Again, we don't use that much. What we use is oseltamivir, neuraminidase inhibitor, most widely used, and also I've used antiviral. So these are the dosages from Indian Academy of Pediatrics Standard Treatment Guidelines. We can have this chart printed or keep in our OPD so that we can refer it quickly, and depending on the age and weight, we can calculate doses and prescribe accordingly. So prophylaxis, more than 3 months of age, we can use doses once a day for 7 days, some guidelines at 10 days. For treatment at any age, we can use twice a day dose for 5 days. So the dosage are according to weight and age that we have seen. Adverse reactions associated with generally well tolerated. GI side effects are there sometimes, and they may increase with increasing doses, but we don't use such high doses. Some adult ID expert do use, but in pediatrics we don't use such high doses. Occasionally it may cause bronchitis, insomnia, vertigo, abdominal pain, epistaxis, bronchitis. So these are very rare side effects, but in and all, oseltamivir is very well tolerated drug. And again, the IDSA recommendation are there in institutional outbreak for chemoprophylaxis, continued for 14 days and for 7 days after the onset of symptoms of last person. So there is role of oseltamivir in chemoprophylaxis also. Okay, so these are the those who onset of symptoms upon more than 48 hours before presentation with persistent moderate to severe illness may also benefit from treatment, but safety and efficacy in this population not be evaluated. So for treatment part, ideally start within 48 to 72 hours. So we will go to the cases in short. This is the case 1, a 2-year-old child presents with sudden onset of high fever, 104 degree Fahrenheit, cough, and somewhat lethargy. Some oral intake has been reduced. So this is the most common cases we receive in our OPD, and they are typical viral scenario. Examination reveals red throat, nasal discharge, scatter bronchi. So, and there are some GI symptoms also, experiencing vomiting and diarrhea. So is this influenza infection? Yes, this is influenza-like illness, because as we know, it fits into fever, high grade, respiratory symptoms are there, some GI symptoms are there. So in pediatric patients, there are more than 2 mucosal illnesses, mucosas are involved. So it will more likely like in a viral infection only. So this fits into influenza-like illness. In which category does the child comes now? If the child is having cough, high-grade fever, and lethargy. So it may come in category A, category B. We have to look for that. If child comes in category A, we can wait. If child comes in category B, we need to start treatment. And how we should initiate treatment now, because this child is having a high-grade fever, cough, and lethargy. This child definitely comes in category B. We should start treatment. In addition to all the signs and symptoms mentioned, so child with, along with, as we discussed, high risk conditions also, like predisposing factors, pregnant women, persons with more than 65 years of age, having previous diseases like lung, heart, and kidney, liver diseases. So even they don't fall in category A, we should start treatment as we discussed previously. Category B, we can send investigations and start oseltamivir. Now, this is case 2. A previously healthy 80-year-old boy was brought to our institute with moderate fever, cough, and occipital headache since 5 days, and one episode of generalized clonic convulsion associated with fever just before admission. Immediately after admission, he developed right-sided focal convulsions were controlled with IV midazolam on admission. A febrile BP 110/70, heart rate 82, respiratory 24, saturation 97, it's 96, G sustained by 15, pupils bilaterally active, terminal neck stiffness and rest. So this is child having like typical encephalitis like picture. CT again reveals similar picture. Subcortical white matter in the posterior lobe, bilateral series of encephalitis. Lumbar puncture shows 40 cells, protein 48 milligram per deciliter, glucose 71 milligram, no organism seen on gram stain, chest X-ray reveals small focal acceleration, right lower zone. So this child came during the peak influenza season, so we suspected we keep our differential as an influenza viral infection also, because a rare possibility, but influenza can present as an encephalitis like picture rather than respiratory picture. So sorry. Nasopharyngeal aspirate tested for H1N1 in positive, CSF1 negative for H1N1, CSF PCR for RPS plus virus was negative. Additional viruses such as the enterovirus and were negative. So broad spectrum IV antibiotic, oseltamivir and aciclovir were initiated, and the sensory improved after 48 hours, and there was no further seizures. The patient was given oseltamivir for 5 days, and he was discharged after 10 days of hospitalization. So this indicates that if we diagnose correctly and give treatment correctly, we can treat our patient with proper diagnosis and proper treatment. So the use this highlights the use of oseltamivir in proper conditions. In as we have discussed, we should look for the high risk patients, whether they fall in category A, B, C. High risk patients who fall in category A should also receive the oseltamivir. Don't wait to go into the category B. But otherwise, no high risk patients who comes in category B, start immediately oseltamivir. Don't wait for investigations. Thank you. Thank you very much.
Thank you, doctors, for your insights. It was wonderful. And I just I'm asking, earlier time, I mean, in our time, I will say if we are from the old group, bacterial infections were more common than viral. Today, I suppose viral infections are becoming more common. Is it so, sir?
Yes. What we see is 70 to 80% of viral infections.
Exactly, huh?
So viral infections are more common than bacterial infections nowadays.
आमच्या वेळेला काय असायचं पहिलं बॅक्टेरियल जास्त असायचं नाउडेज व्हायरल इज बिकमिंग मोर कॉमन
Now in our OPD is almost 70 to 80% of viral.
Yes. Thank you so much. I mean, I'm sure the audience must have benefited from these insights.
Yeah.
Thank you.
Thank you.
Thanks, doctor. Thanks all the doctors who have attended this session, and thank you marketing team, the field people for coordinating, and thank you IT team of ITRO for super coordination. Thanks all of you. Signing off. Wish you a very pleasant evening. Thank you, sir.
Keyur, thank you. संपला ना. हॅलो